Assisted hand hygiene and don gloves. Hi, I'm Ella, gonna be your nurse today. Can I do a physical assessment on you if you have time?
Yeah.
All right, can you tell me your name and date of birth?
It's Emma Holiday, date of birth 5/11/2000.
All right, I'm gonna check your wristband. Perfect. Do you know where we are?
At the hospital.
Do you know what town we're in?
Salem.
All right, do you know what time, what date?
It's
it
the
is?
23rd
All
of
right,
October.
perfect. Do you know why we're here?
We are here because I fell at home.
Okay.
I was trying to feed my chickens and I just
Oh no.
cracked it on the concrete.
Yeah. So she's a learn-oriented times 4. Okay, and while I'm checking her, I'm also actively looking at her skin color, looking at her hair. If she's smiling at me, it's showing she's alert, what her nourishment looks like. So before we get started, do you need to use the restroom?
Nope.
Okay, so I'll tell the CNA later whenever she's ready to get up to let me know so I can assess her gait when she goes to the restroom. Okay, I'm going to go ahead and get you up to a sitting position so I can start assessing you. And we're going to go ahead and start with your eyes, okay?
Okay.
Okay. I'm going to need you to look right here at my nose and I'm going to shine a bright light in your eyes, okay? Alright. I was checking her perla, so her pupils are equally round and reactive to light and they were accommodating. And she doesn't have any redness in her eye when I'm looking at them. So I'm also going to do the 6 cardinal points. So now if you could continue to look straight ahead of my nose, but follow my pen with your eyes. Okay, perfect. And that looks good. She doesn't have any discharge. The color looks good. And she didn't have any nystagmus, no rapid movement in her eyes. So I'm going to go ahead and move on to her ears. So I'm going to just take a peek in your ears. Perfect. We don't have any fluid in them. They're looking good. And then I'm going to go ahead and take a look in your mouth. I have gloves on. And so if you could open up, I'm going to stick this on your tongue and take a look. All right. Looks good. Your teeth are in good condition. Nice clean mouth. You don't have any blue lips. Your tongue's not red from a B12 deficiency. There's no whiteness, which would indicate thrush. So your mouth looks really good. And then I'm also keeping an eye out while I'm examining the top half of her for any head issues such as sores or lice, bed bugs, or any kind of skin breakdown. Okay, now I'm going to go ahead and take a look at your trachea. I want to make sure it's midline and make sure that if it's not midline, there might be concerns for a collapsed lung. So I'll be feeling your neck, okay? I'm going to make sure there's no lumps in it. Just feel around. And I'm going to palpate the carotid one side at a time. And then I'm also going to look and see if there's any jugular vein distension, which could be an indication of a heart condition if it's bounding. So looks good. Okay. Now I'm going to take a listen to your heart sounds, okay? So I'm going to make sure my stethoscope's turned on the bell side. I'm going to listen to your aortic valve. There's the cold. Now I'm going to move over to the pulmonic. And go down to Erb's Point. and then the tricuspid valve. And then I'm going to switch it back to diaphragm and listen to the apical or mitral. Okay, I listened for 60 seconds and her heart rate is 73. All right, now we're gonna go ahead and listen to your lung sounds, okay? All right. Perfect. Now we're gonna listen to your back. Now I'm gonna go ahead and take a listen to your lung sounds on your back, okay?
Okay.
All right, your lungs sound good. There's no cracking or wheezing, so they sound normal. Perfect. Now I'm gonna check your IV site and just make sure that there's no redness, anything that could indicate infection. There's no streaks or there's no dirty dressings, anything like that. So everything looks good. I'm gonna go ahead and check your capillary refill in both your hands. Make sure we got good circulation. And I'm gonna go ahead and do your radial pulse. Nice strong pulse in both arms. So next I'm gonna have you just squeeze my hands for me as hard as you can. Perfect. And now if you could push down on my hands. Okay, can you pull up? Perfect. All right, she's got a nice reflex in both arms. She doesn't have any club nails, which would be from COPD. Okay. Can you hold both your arms out for me? All right. Perfect, looks good. And do you have a pretty good range of motion? You feel you can move everything with no pain? All right. Okay. And when was the last time you had a bowel movement?
This morning.
And was it regular?
Yes.
All right. And do you, how often do you normally have bowel movement?
3 times a day.
Okay. Do you ever have any trouble urinating?
Nope.
No? Okay, perfect. I'm gonna go ahead and do a visual assessment of your stomach and listen to all 4 of your quadrants for some movement, okay?
Okay.
Okay, all 4 quadrants sound good. And do you have any tenderness? No? Okay. I felt for masses, there was no distended bladder, there was no skin lesions or any signs of tenderness, so that's good. Now we're going to move on to your legs. If you don't mind, I'll pull the covers back so we can inspect your legs. Okay. And this patient has very nice shaped legs, but if she was a man and or a woman and normally had hair on her legs, but it was no longer there, that could be signs of poor circulation. But otherwise, the color looks good and there's no skin breakdown or any edemas. So we're going to move on to the feet. Okay, now we're going to move on to your feet. And can you give me a push and a pull? Perfect. And I'm looking at your feet and they look good. There's no redness on the bottom of your feet, especially if they were diabetic. There's no ulcers. Check your toenail capillary refill. Make sure there's good circulation in both feet. And then I'll check the dorsal pedis pulse on the top of your foot right here. On both sides. And then the tibial pulse on the ankle. Okay, she would get a 2+ because she has a normal pulse that you can feel. And can you show me, do you have good range of motion of your legs and ankles? Perfect. So I'm going to give you a 15 on the Glasgow Coma Scale, which means you have a good rating, everything's in normal range, and that'll complete our physical assessment. Is there anything that I can get you before I leave?
I'd like a donut.
A donut? Okay, I can go get that. Anything else?
No, that's
All
it.
right, I'll get you covered up, and here's your call light, and you'll be good to go.
Thank you.
And now, because I'm not a very techie person, I accidentally deleted the nose part of my video, so I'm going to be using my mom to do this assessment. So now I'm going to take a look up your nose. And there's no drainage, so it looks good.